Hi viewers, welcome back. In today's video, we are going to discuss about true pain and false pain. Okay, so in our previous video, we have discussed what is a normal labor, what are the characteristic features of a normal labor. So now we will differentiate what is true pain and false pain. Imagine you are there in the hospital. You are the duty nurse or the student who is on duty. Okay, so now a woman is entering the hospital, a full-term mother. She is having pain. Okay, she is coming and telling, I'm having severe pain. So now you take the responsibility of identifying whether it is a true pain or false pain. So how you will differentiate this true and false pain? Okay, so there are some clinical features or characteristic features which definitely say that the woman is having true pain or false pain. So the first thing is pain. When the woman is complaining of pain, the onset, that is the way how it started, it will be like it is a regular in onset. Okay, so it starts regular and proceeds regularly. That is like in case now the pain has started around 10 o'clock in the mornings. Okay, it starts 10 o'clock. It will be there for one maybe few seconds or minutes. Okay, and it will leave. Then again it will come after 1 hour or after 2 hours. Okay, then again after some duration it will begin again. So that is like a quiet period of interval will be there, but this pain will be regular. It is not continuous. But for a false pain, it will be a continuous pain. The mother says that I am having pain from the morning. From morning 10 o'clock I am having severe pain. Only that will be her complaint. But for a mother with true labor pain, she will say that I am having pain which is coming intermittently. I am having intermittent pain. Every half an hourly, every 1 hourly I am having pain. So that will be the differentiation with the pain. So in a true contraction, the pain is at regular intervals, whereas in false contraction, there is no regularity. The pain is irregular. The second point is increasing intensity and duration. Okay, so when the pain begins, it will be mild. Okay, there will be mild pain, but with time and duration the pain level increases. Okay, so around 10 o'clock there was a mild pain, but around 12 o'clock there will be little more intense pain. Around 2 o'clock there will be moderate level of pain, and then around 6 o'clock there will be a little more severe pain. Okay, so that is the way the pain increases. The intensity increases with the time, okay, and the duration. So in the beginning of 10 o'clock, it was for maybe it is for like maybe if it is for 30 seconds. By evening around 6 o'clock, it will be for 45 seconds, like that. So it is like, for example, I am telling, okay, so the duration is going to increase with time. Okay, the pain and the intensity is going to increase with the time. That is like from morning till evening or from evening till morning, like that. The intensity and the pain severity is going to increase with time. But for a false contraction, there is no increase like that. Okay, it will stay like that. It started, the mother, how the mother will report, she will tell I am having severe pain from the morning. Okay, so she will not express that she is having increase in the pain level. She will tell from the morning it is same pain, like that only she will report you. So which gives an identification that it is a false pain. So now with that pain increasing levels, you can identify whether it is true or false contraction. And then comes the next factor of show. What is show? Show is nothing but it is the bloody discharge of the cervical mucus plug. Okay, cervical mucus plug is the protective plug that is preventing the baby from infection. So it is like it is going to lock or it is going to seal the cervix during the pregnancy. Once the labor is getting initiated, this cervical plug has to come out so that the cervix starts dilating. But now first thing is like this mucus plug has to come out. So it doesn't come out just like that. It has to come with mild bleeding. Okay. So your thick, white, bloody discharge, that is called as show. In case if it is a true pain, there will be show present with that true pain. But for a false contraction, there will not be any show. There will not be any discharge. Okay. So show is absent in false contraction. But in case of true contraction, show is present, which is indicating the woman is going in for labor. And the next sign is progressive effacement. What is effacement? Effacement is the taking up of the cervix. That is like, now imagine the baby is inside the bag of uterus. Okay. So now if the baby has to come out of the bag, what has to be done? The bag, the opening has to be pulled up like this. So it has to get opened up like this. Okay. So what happens? Then only the baby will come down. So now what happens? This effacement process, that is like that pulling up of the cervix, is called as effacement. If it is a true labor, if it is a true contraction, then what happens? This taking up of cervix happens. But when in case of a false labor pain, no taking up of cervix or no effacement is seen. Only your pain will be persisting continuously. Okay, so no effacement in case of a false uterine contractions. And then comes the dilatation. What is dilatation? Okay, I said already, cervix is a locked area. Okay, so it is a sealed area. This cervix will open only when the labor is getting initiated. When the labor begins, what happens? This cervix starts dilating. So it has to slowly, it will open up like this and it will allow the fetus to come out. So now this dilatation happens only if the pain is true labor pain, that is when the woman is going for delivery, or otherwise this cervix will not open. Only false contraction will be there, but the cervix is going to be sealed up. It will be sealed. There will not be any opening. When you put your PV for opening, just when you do a PV, you can't enter your finger inside the cervix, which is showing it is a false uterine contraction. Okay, so that is again an indication that there is true labor. And then coming to formation of bags of water. What is formation of bags of water? So already I said the labor is going to get initiated. The uterus is thinning up. So the uterus is giving way for the fetus to come down. So what happens? The bag will become loose at the lower uterine segment. So it will form bags of water. What is bags of water? The bag of water. So the uterus is having big water, that is amniotic fluid inside the sac. Now what happens when the labor is getting initiated? You will have two compartments, the upper uterine compartment and the lower uterine compartment. The upper uterine compartment will be staying like that, and the lower uterine compartment, which holds the head of the baby, will start pulling up with the amniotic fluid. So that is like it is collecting the amniotic fluid and it is getting swollen up. So now what you will do when the labor is getting initiated, this bag will break and the amniotic fluid comes out. So when the fluid is coming out, the labor is getting initiated and the baby will come out easily. So this is the way the labor is getting progressed. Okay. So now this bag formation will not be there for false uterine contraction. It will be there only for true uterine contractions. Okay. So again it is an indicator that it is true labor pain. Okay. Then finally, when you ask the type of pain for the mother, so how is the pain? Ask with the mother. Tell the mother to verbalize her pain. Where did it start and where did it end? Okay. So when you ask the mother how is the pain, she will start explaining her pain. She will tell that the pain started at the lower back. From behind she will show. Okay. So she started from lower back, it comes through the sides, it crosses the fundal region, it spreads over the abdomen, comes down and vanishes. Okay, so this is the way labor pain happens. So how it has to begin? It has to begin from the lower back. So it has to start from lower back, come towards the side of the fundus, that is through the fundus, it has to spread to the center of the uterus, it spreads over the abdomen, and it comes down, that is to the lower uterine segment, and it vanishes by itself. This is the sequence of pain in a true labor contractions. Okay, so now you will be able to clearly identify whether it is true labor pain or false labor pain. But when you ask the pain of a mother who is having false contraction, what she will tell? She will tell, I am having severe pain only in the abdomen. From morning I am having abdominal pain only, madam. It is not going. And when this pain will go for a false contraction mother? Tell the mother to walk little. It is just a gastric pain and an acidic type of pain. Okay, it is because of acidity. Okay, so if you tell the mother, they will have you tell them to have a mild walk, a little change in position, maybe a hot drink, a hot tea, or otherwise a lemon tea, or otherwise tell the mother just to have a hot drink. Anything is sufficient. Or otherwise sometimes like some mothers and some mother-in-laws, they prefer giving kashayam. Okay, so that is like with the jeera and some herbal leaves and all those things, they prepare kashayam and they give. So it is very effective. It finishes the false contractions. Okay, so this is the difference between your true contractions and false contractions, which clearly says the mother is having true or fluke contractions. Okay, so first, so when the pain begins, it has to begin by itself. At the time of beginning, it is irregular, then it is becoming regular and regular. Okay, so when it begins at the lower back, spreads through the fundus, enters the abdomen, stays over the abdomen, comes down near to the lower uterine segment and vanishes. So the pain becomes more severe and intense day by day. That is day by day in the sense like maybe with hours it is going to increase. And then there is show combined with normal true labor contractions. For false, there is no show, no effacement, no dilatation for false contractions. Only in true contractions there will be show, there will be effacement, there will be dilatation. And finally, there is formation of bags of water, which is again an indicator that the woman is proceeding into normal labor. Okay, so these are the signs and symptoms of true uterine contraction. So when you get a question in the exam saying that differentiate true and false contraction, you have to contribute all these points, which is very clearly says that the woman is going in for normal delivery. Okay, so with this we finish this class, and next class we'll start with the labor process. Okay, till then take care, bye.